This is a presentation about the axial calcaneus view by Connor Arthur. The axial calcaneus view is used to evaluate the planar aspect of the calcaneus, and it is also used to see any medial or lateral displacements of the calcaneus. When x-raying the calcaneus, collimation needs to be 1 inch on all sides surrounding the calcaneus with the fifth metatarsal base included and proper marker included on it as well. The central ray should enter the foot's plantar surface, entering at the base of the third metatarsal. This is directed to ours midpoint. There should be a 40-degree cephalic angle on the tube to clearly present the calcaneus. As far as technical factors of the X-ray, they should be set at around 60 to 70 kVp and 7 to 15 mass in a normal, healthy patient. Technical factors may vary according to the patient's health or their body habitus. Evaluation criterion is an essential aspect to any X-ray view. For the axial calcaneus, there are several points that are needed to be reviewed to make sure this image is acceptable. First off, adequate collimation is a must. The entire calcaneus and calcaneocuboid joint must be displayed. The first or the fifth metatarsals are not supposed to be displayed on either side of the foot. This means that rotation will be prevented if this rule is followed. Good detail of the whole calcaneus must be on the image. Surrounding soft tissues, a good marker on the correct anatomical side, and all the anatomy must be present in this image. Make sure that the foot is dorsiflexed to ensure that the foot's plantar surface is perpendicular to the image receptor. These are the few points of evaluation criteria that must be met. This image is an example of a well-positioned axial calcaneus. Even though a marker isn't present and some of the soft tissue is clipped, this still displays a good image. This image was more than likely cropped to display anatomy on a website, so the soft tissue and the marker were probably chopped off in some kind of processing. To review the image criteria, the calcaneocuboid joint is open. The whole calcaneus is seen in detail and there is no rotation. So this indicates that this is a good image. Here we have an image that is not of good quality and does not meet all the evaluation criteria. This axial calcaneus view has several points that make it an unacceptable image. First off, the image is underpenetrated, so the technical factors are not up to par. This image is underpenetrated. The metatarsals and the calcaneocuboid joint, the space isn't visible. So we have a hard time distinguishing these anatomy, so the radiologist would have a hard time reading this image to make an accurate analysis. You can see a slight amount of rotation in this image as well. You know, that's not the hugest deal, but to be a perfect image, it doesn't meet that category. And the marker is visible, but as you can see, part of it's cut off, is collimated out, and it could be aligned better anatomically to make it the image marked clear. So these are the points that make this a bad image and things we could capitalize on next time we take an axial calcaneus. This PowerPoint shows the description, the examples of good and bad axial calcaneuses, and evaluation criteria needed for an axial calcaneus view. Before completing this project, I wasn't fully comfortable and understanding of all what went into an axial calcaneus. So this project brought some helpful insight that will help me for many years to come as a technologist. And I appreciate each and every one of you viewing my PowerPoint, and I hope the best to you this semester. Good luck, guys.